Fears are growing that it won't be possible to stop the global spread of coronavirus. Health experts have warned that the chances of containing it are diminishing as cases appear in more countries.
The coronavirus's rapid global spread has several countries scrambling to take emergency measures. Most recently, Japan, South Korea, and Italy have had a sharp increase in the number of cases. This novel coronavirus strain, officially named COVID-19 by the World Health Organization, was first discovered in Wuhan, China in late 2019. The outbreak was declared a public health emergency in February, and patients have tested positive for the virus in more than 40 countries on 6 continents.
This virus has pandemic potential, and WHO is providing the tools to help every country to prepare accordingly.
We saw this acceleration, which is now so obvious to everyone. You know, we started off with 25, 50, 100, several hundred, 1,000, 5,000, 10,000. So we had no idea where it was going. The situation was such that we already saw that the introduction into our country was through travel-related cases, and we had the capability of being able to identify, isolate, and contact trace the cases.
We know that the coronavirus is a respiratory disease that can be spread when people come into close contact with each other. Common signs of infection include respiratory symptoms, fever, cough, and shortness of breath. According to the Centers for Disease Control and Prevention, it may be possible that a person can get the coronavirus by touching a surface or object that has the virus on it, and then touching their own mouth, nose, and possibly their eyes. People are thought to be the most contagious when they don't have any symptoms or mild symptoms. The coronavirus is also unpredictable because it is an entirely new strain. Even though the flu has been a greater threat in the U.S., it is not easy to compare.
The issue is that the thing about flu, as much suffering and death that occurs every year on a seasonal basis, we have a very good experience and know exactly what flu is going to do. You can be guaranteed that as we get into March and April, flu will diminish and essentially get off the radar screen. We have a good prediction of what the range and the bracket of the morbidity and the mortality is. So we know this is the unknown. Coronavirus is the unknown. We have no idea what its potential is, the direction it's going, or where it's going to end. And because of that unknown, it was felt that we needed to do something that in many respects was unprecedented.
We also know which age groups are more susceptible to contracting the virus.
So far, we're seeing mostly older people who are dying, which from a public health perspective is better than having it be younger, healthier people. So we're going to be closely monitoring to see whether that profile changes. But for the time being, this is more like what we see with flu, where it's the immunologically compromised people who tend to be older adults who are most affected.
The coronavirus can also be fatal to critical care health workers who are repeatedly exposed to the virus for an extended amount of time. The U.S. government enacted measures to contain the spread from China. On January 31st, the administration announced foreign nationals who had traveled to China would be denied entry into the United States.
The president has signed a presidential proclamation using his authority pursuant to Section 212F of the Immigration and Nationality Act, temporarily suspending the entry into the United States of foreign nationals who pose a risk of transmitting the 2019 novel coronavirus.
The coronavirus has had significant impact across almost every industry. Worldwide stock markets have fallen over fears of a pandemic. Japan announced they would close schools until April, and the 2020 Summer Olympics in Tokyo could be impacted because of the coronavirus. And those who study and work on infectious diseases are still unsure what will happen next.
So a lot of what we're saying now is based on current data, and as we get more data that come in, some of these initial characterizations of the disease may change a little bit. And again, that's not going to be because people were not being truthful earlier. It's just that as we get more data, we can be more precise and we can be more accurate.
Right now, the risk to the American public is low, but, big but, That could change because this is an evolving situation. And if it evolves into a true global pandemic, then we would have a very serious problem here in the United States.